So you probably take amlodipine or Norvasc for high blood pressure or heart disease. In this video, we'll cover 7 of the things to avoid while you take amlodipine. I'll explain why it's so important to avoid these things. I'll give you actionable tips to help, and this will keep you safe and avoid dangerous side effects. And if you're new here, my name is Dr. Khalid. I'm a family doctor from London, but first we have to understand how amlodipine works. It is one of the most commonly prescribed medications in the UK and the US. It's often given for high blood pressure, heart disease, and is part of a group called calcium channel blockers. These work on your body by relaxing and widening the blood vessels so that your blood pressure drops and the strain is taken away from your heart. The very first medication to be cautious with is in a family called statins, and it's Simvastatin. Statins are one of the most commonly prescribed medications on the planet. They help lower your cholesterol, and in the long term, they can help avoid heart attacks. But when you combine amlodipine with Simvastatin, they are both processed through the liver. And it's processed in the liver by an enzyme called P450 isoenzyme CYP3A4. Did you need to know the exact enzyme name? Probably not. Did it help me make a random Star Wars joke? Definitely. Okay, so think of it this way. The enzyme is like the door out of your body, and only one of the medications can pass at a time. Amlodipine goes first, because let's just say amlodipine is a lady and chivalry is still alive. Simvastatin, on the other hand, is a gentleman and hangs back in your body. While it's waiting, the levels of Simvastatin are rising and it's higher than it should be. While amlodipine is putting her makeup and maybe taking a last-minute loo trip whilst the Uber is waiting outside, then Simvastatin levels are going up and up instead of going down. And so this could be dangerous because the higher levels of Simvastatin can damage our muscles. So it's not recommended to be on a higher dose than 20 milligrams of Simvastatin at the same time if you're on amlodipine. And certainly if you're getting muscle aches, fatigue, discomfort, then you should speak to your doctor. And the other important caveat is that not all statin medications are processed in a similar way. And often what I would do is if somebody's on amlodipine and Simvastatin is switch them over to an alternative one. So you've got atorvastatin that I would go for, pravastatin or rosuvastatin. These are better alternatives. On to number 2, you should avoid eating grapefruits and drinking grapefruit juice. Now, in my 37 years as a board-certified human being, I don't think I've seen anybody regularly drink grapefruit juice, but it was in all of our medical school textbooks that if a person is taking grapefruits or grapefruit juice with these medications, warn them. So I'm warning you, heads up. And the key thing here is it's thought that grapefruits increase the strength of amlodipine in your body, so the levels will be much higher than you would expect. And therefore, it can make the side effects a lot worse. So your blood pressure can drop significantly. And with low blood pressure, it can make you feel unwell, from dizziness to feeling lethargic. It can make you feel short of breath, or you can faint with them. And it can put a bit of stress on the heart too. And so you might be thinking, gee doc, aren't I taking blood pressure medications to get a lower blood pressure? Well, that is true, but what we wanted is in the good, safe range. Too high, and it can be dangerous. Too low, and it could also be dangerous. And in this video up here, I've explained what that range is and what is a safe level. On to number 3, and that is to avoid St. Johns Wort. So if you're not familiar with it, and it's definitely not a wart on a priest's foot, just FYI, St. Johns Wort is a herbal remedy that some people use for depression. It's over the counter, so you can get it readily available from any supermarket or pharmacy. And it has some effectiveness in mild to moderate depression. But one of the downsides is it can also affect this enzyme, the C3PO one that we talked about, which means that it can lower the effectiveness of your amlodipine. And so the dose that your doctor prescribes you may not be as effective. Okay, on to the next one, and this may sound really obvious, but we might as well talk about it. Other calcium channel blockers. I think every year there's 1 or 2 patients that when I'm reviewing their medications, I look at the medication, I'm like, dude, you're already on a calcium channel blocker. What's going on? You've got 2. So other ones, just for your reference, are verapamil, diltiazem, felodipine. The difficulty is that there's lots of, those are the generic names, by the way, but there's lots of brand names, that companies come up with for those things. For example, for diltiazem, there's all these, and cardizem is the one that we commonly see. But if your doctor doesn't know about the different brand names, or it's kind of flicking through it and has started you on something without checking things properly, then a person can be on two medications that work in the same class. The danger, obviously, is you're getting the double the effects, more likely to get side effects, and you're more likely to get a potent drop in your blood pressure. And that's why I always think it's really important to know why you're on a certain tablet, what the side effects are, and be informed so that when somebody's starting you on a new drug, you could be like, well, actually, I'm taking drug X, Y, and Z, and isn't that a calcium channel blocker? That little prompt can often help doctors from, going from autopilot mode to picking something up that could be a drug error. Okay, the fifth drug to avoid are antifungal medications, so fluconazole, itraconazole, and all the brands that go along with them. If you take any of these medications, say for a fungal toenail infection, then it can increase the blood levels of amlodipine. And that again can make you feel unwell because the side effects are more likely and your blood pressure can drop lower. And the same thing can be said about number 6, which are certain antibiotics. These fight off bacterial infections in your chest, skin, other areas. And the key ones are clarithromycin, erythromycin, and rifampicin. So not all antibiotics will have this effect, just these ones particularly that are getting processed through the liver and going through that same door, the 3PO door that we talked about, and therefore they are competing for that same door. And similar for antibiotics, they increase the blood levels of amlodipine. And again, you're getting a more potent effect from maybe a smaller dose of amlodipine than you would expect. And the key things to look out for are low blood pressure symptoms, so feeling faint, dizzy, tired, or actually fainting. And finally, onto alcohol. Whilst the NHS, which is the UK's health service, advises that you can drink alcohol with amlodipine, there is an important caveat, and that is that alcohol itself can drop your blood pressure. And so if you're having medications that already do that, you can compound that effect and it can make you feel unwell. And let's not forget that when we're drinking alcohol, very rarely does somebody carry a water bottle with them and keep themselves hydrated. That's why we get usually the hangover effect. So dehydration, again, is something that can push your blood pressure low. So you're getting all these compounding effects. Some sensible advice would be to drink in moderation, make sure you're drinking water at the same time to keep yourself hydrated, and just making sure you're not having any binge episodes where you're drinking lots of units of alcohol in a short space of time. And so it's not an absolute never drink alcohol. It is important to also remember that the prevailing winds of science is changing towards alcohol. It used to be in the UK that you could drink 21 units. Over the last few years, it's dropped to 14 units. The WHO last year released some data that suggests that no alcohol is actually good for us. So if you are on the fence about that, I would suggest starting to reduce alcohol with a view to cutting it out of your day-to-day life. A really important thing to say right now is that if you're on any of these medications mentioned, don't just stop it completely. Never take the advice of some random dude on YouTube, even if they're a doctor. Always speak to your own specialist and your own doctor. It's important to be well informed. It's even more important to speak to your doctor who knows your health far better than some random dude on YouTube. And there are times that these medications can be combined. For example, there was a time where I gave somebody clarithromycin with amlodipine just because they were allergic to pretty much every other drug under the sun. But the important caveat I gave them was, look, this can affect your blood pressure. I would like you to look out for these symptoms. And also, I would like you to monitor your blood pressure a lot more closely than you normally would. So when you have that level of safety and follow-up, then it's more of a controlled setting and not as dangerous. Now, we talked about some low blood pressure symptoms, and if you're wondering what is low blood pressure, what are the ranges, then click over here on the next video. I'll see you on that one. Take care.